The Premier is currently on the podium. Let's take you there live now.
Also encourage departments to maximize their cooperation in addressing challenges emanating from this pandemic. In terms of additional grades returning to school on the 6th of July, the Minister of the Department of Basic Education, Honorable Angie Motshekga, on Thursday the 2nd of July, hosted the Council of Education Ministers, which then agreed on the grades that will return to schools tomorrow and subsequent other grades at a later stage. That decision was reached after careful considerations of all factors presented. The national decision was that grades 6, 11 and R will return to school on Monday, the 6th of July. However, KwaZulu-Natal have opted to delay the return of grade R to school until a later date that will be communicated in due course. In preparation for the returning grades, the department has purchased additional COVID-19 essentials. The department has also a challenge of ensuring that both learners and teachers who have underlying health conditions are protected from the virus. Necessary measures have been put in place to support the learners and teachers. Measures are in place to ensure that there will be no classes without a teacher. So there will be no class in all schools without a teacher. With regard to infrastructure update, in light of COVID-19 pandemic, the Department of Education continues to ensure proper water supply to all schools throughout the province. 3,429 water tankers have been provided to schools. Further, as part of health promotion to minimize health risk in schools, the department has a responsibility to ensure that schools have sufficient sanitization facilities. 1,060 toilets have been provided to schools after an audit. The dislodging program in rural areas is also implemented and monitored. With regard to nutrition program, as more grades return to schools, the department is ready to provide all learners with nutritious meal as prescribed. In addition, the department has put in place systems to provide meals even to learners who will not be returning to schools tomorrow. There are 2.34 million learners from 5,344 schools who are the beneficiaries of this program. The department has taken necessary precautions to prevent the spread of virus while preparing and serving meals to learners. Food handlers have been trained in the prevention of COVID-19 spread, and the necessary PPEs have been delivered to all schools. As KwaZulu-Natal, in terms of our own situation and advancing going forward, as grimy as the current statistics are, the curve have not yet exceeded the projected prevalence and bed occupancy rate. However, we must hasten to emphasize once again that we are now in the eye of the storm. It is vital that we abide by the regulations and take all the necessary safety precautions. We should at all times be mindful of our safety during social interaction and adhere to protocols such as avoiding large gathering, practice social distancing of at least 1.5 meters, wash our hands regularly with soap and water or use sanitizer, not to shake hands and to cover our nose and mouth when we sneeze with elbow. It is important that we emphasize these protocols. What do we do if someone tests positive? If someone tests positive in the workplace, we must not panic. Let us contact the National Institute for Communicable Diseases on their toll-free number, which is 0800 299, or the provincial hotline number, which is 033 846 6000. We also use a WhatsApp number, which is 060 0123 456. Now, we'll want to emphasize the point that it is in our hands, as the government will continue to do everything we can to educate and create an awareness to further ensure that we provide all needed medical support, bed capacity, and everything that is expected. But it is now a responsibility of each and every citizen to ensure that he or she is protected and protect others. So we all carry an equal responsibility. It is in our hands as the people of KwaZulu-Natal. I thank you.
Thank you very much, Honorable Freeman. Can we take the question to start with the colleagues that are here, and then take those that are working on other platforms? Can I get an indication of that? Number one. Can start, Mr. Wade.
I think this question is more directed to Ministry of Health. It's in relation to other issues at Chief Hospital. This past week there has been a protest corner in regards to the provision of masking and PPE. A memorandum was held. So what I wanted to know is if the matter if OMC has seen them, and if she engaged with the unions or anyone who's dealing with the matter.
Thank you very much, Sheila.
Thanks. Umbuzo owokuqala ngizobhekisa ku-emisifo economic development. Lana kunabantu abasebenzayo emafemini abakhululenayo ngokuthi abaqashi ababanakekeli ababanikezi zonke izinto ey'fanele bayasebenza, and kuba khona nabantu abatholakala begula bengatholi ukuthi bathestwe. Then omunye umbuzo wesibili ukuthi kunabanye abantu abaqashi abaye bayekisa abantu abasebenzayo emsebenzini yabo roundabout ngabo-March, kodwa otholakala ukuthi one ababanikezi iy'ncwadi ze-retrenchment, okwesibili kwayona i-1F abayitholi. Nawo umbuzo wami ukuthi mhlawumbe yini into esingayenza njengabantu bendaba ukuthi sibasize abantu, sibatshele ukuthi bangenza kanjani kuleso simo esinjalo. And then bese kuthi omunye umbuzo wami ubhekise mhlawumbe angazi kungakhulu ngoba akekho MEC for transport. Kunenkinga lana abantu emateksini bakhala ngokuthi kuyagcwala. Amateksi alayisha 100%, ikakhulukazi endaweni eziya ngasemakhaya la kungekho khona ukunama kakhulu noma ukugadwa kakhulu ngenxa yamaphoyisa. Manje bayasaba ukuthi bazongenwa izifo ngoba osomatekisi akukho ukuthi bagama, bayazenzela nje, impilo zabo zisengcupheni. Then bese kuba omunye umbuzo wetobhekisa ku-MEC for education. Lana sesithole kaningi imiyalezo yokuthi iy'ngane ziyabuyela esikoleni noma ziyabuyela noma zibe zingabuyeli. Manje into engifisa ukuyazi ngiyazi ukuthi ngoLwesine uMinister for Education wahlangana nabo bonke MEC from different provinces. Kwawukuthi kwaphuma isinqumo sokuthi ugrade R nalo amanye amagrade amabili bazobuyela esikoleni and the rest will remain until further notice. Now into engifuna ukuyibuza ukuthi ngabe abazali niyaba-involve yindaba ngoba kunabazali nabo abakhathazekile. Ngabe nina niyodwa niyiphathimandla noma niyihulumeni nimane niyithathele iy'nqumo niyodwa ningahlangani nabazali ukuthi kubonakale ukuthi ikuphi bona abakubona kubalulekile. Hence kulokuqhamuka lezi zinto lezi ukuthi bayabuyela abantwana noma babuyeli.
Okay, thank you very much. Khalid?
It's Katie from the Marketing. I just want to know, there's been a lot of talk on certain areas being put on a harsher lockdown. Is that possible for KZN, and which areas would we be looking at?
Okay. Just to add to the comments so that they can answer comprehensively. There's another one from SABC, I should start with Eyewitness News postcard, who was asking the question that the recovery rate is now sitting at 33%. At some point it was above the national average. Has the department ascertained the reason behind the decrease in the recovery rate percentage-wise? And then Ayanda is asking the question to the Premier. Government has been making a plea for people to adhere to safety precautions and regulations, but it seems to be falling on deaf ears. Is there anything government has to do to ensure that people comply to the MEC for education? We're still receiving reports of schools without proper water and sanitation. What is the current situation, especially now with educational learners and teachers returning to schools? I will hand over to the
Good afternoon, ladies and gentlemen. I think I only have about 2 questions that I need to respond to. The first one relates to the issue of infections of health workers in Chief Albert Lutuli. And I think we did the same thing last week. We would rather not focus on one hospital, but raise our concern in relation to infections of health workers generally. Because we see a trend where health workers across the province, and probably not just in the province, in the country, are getting infected. And this is where we are saying it's necessary for us to ensure that the protocols that have been put in place should be adhered to, both by our health workers and by the management. And as I indicated in last week's meeting, we've had a session with the unions where we agreed on protocols that were going to be implemented, and among those was an issue of re-establishing an officer that's going to be responsible for the management or for the implementation of the protocols. Now, this OHS officer will make sure that they walk around the facility and ensure that management is doing what they are supposed to be doing in terms of providing the proper protocols, following proper protocols, ensuring that PPEs are given to staff as they should be given, but also ensure that our health workers themselves wear the PPE properly and they adhere to the protocols of sitting around or of engaging with each other within the facility, because we have found that is one of our biggest challenges as well. The fact that our health workers from time to time they will congregate together, but when they are outside of the ordinary wards, sometimes a mentality that they are not going to be infected because their health workers prevail. So we are also speaking to our health workers that they must remember they are part of the society, they are part of the community where the infection is spreading. While they take care of themselves when they are actually taking care of the patients, but they also need to follow protocols of wearing masks, washing their hands, observing social distancing among themselves, because you will never know when we are sitting around here who has been exposed and who hasn't. And we have found that that is where the issue, the biggest challenge is. And we've agreed that we are going to go back to all our facilities, start demarcating even in areas where our health workers are sitting and are eating. Now, that is a broad principle that we have taken in the whole province, and we have started establishing, and we've started implementing it last week. It's a similar thing that's going to have to happen at Chief Albert Lutuli. However, we have also realized that the numbers at Chief Albert Lutuli are tremendously high. And they are going up. So we've decided that we have actually started instituting a focused investigation starting from Thursday that's going to look at what is actually happening in Chief Albert Lutuli specifically and be able to deal with the issues there. Having said that, it is very disheartening that when we speak about the issue of the virus that is infecting and our health workers being infected in Chief Albert Lutuli, but we found them standing around at the gate, all of them in one space congregating. It means, by the way, by Wednesday next week, we are going to have even higher numbers from that particular facility, purely on the basis that they themselves are saying they are infected, but they don't have a problem with sitting around and talking to each other and toying around the gate when there's more than 200 of them. So that is a serious one. While we appreciate the responsibility of, while we appreciate that workers have a right to stand up for their rights, and we support them very much. But at this time, we think there's a better way of handling it, and standing around and congregating in one setup when we are saying amongst ourselves, we are so infected, but we must then stand together and still continue to infect each other even more is a problem. So this is a matter that we are taking on. I must also indicate that about a week or so back, we received a complaint from Chief Albert Lutuli, a specific complaint that was saying, maybe let me start by saying we don't have a problem of a shortage of PPE in Chief Albert Lutuli. Chief Albert Lutuli, like any other hospital in the district or in the Metro of eThekwini, has sufficient PPE. However, we received a specific request from Chief Albert Lutuli Hospital where they were insisting that they wanted a specific kind of PPE that is not in the NICD guidelines. And we had to sit down and explain to them that they themselves, like any other health worker in eThekwini, are supposed to be given PPE that covers them, and it covers them in a particular way. By the way, the guidelines of NICD are specific that when you are in this particular risk area, this is what you must be given. But as you go higher and you get more exposed, this is what you are given. And they have been given that kind of PPE. However, they believe it's not sufficient because they got advice from a particular doctor elsewhere that they should be given something that is different. Now, that can't happen. It just can't happen because all our health workers in the whole province should be treated equally. There is no health worker that should be given a specific preferential treatment. But the kind of equipment that they are also looking for is not something that as a Department of Health generally we buy. And the head of department, by the way, last week went and met with the health workers that were raising this issue, and he was able to clarify the matter, and when they were done, we thought that the matter had been dealt with. Having said that, we will still investigate if there are any other issues that need us to focus on, and we'll be able to change the situation if it's necessary, if there has been any wrongdoing on the side of the management. In relation to the recovery rate, yes, Unkoskona is correct. Right now we are just above 30% in the recovery rate, and the question is why. We must remember that it's only in the past 14 days that as a province of KwaZulu-Natal, we started getting higher numbers. Therefore, those higher numbers that we started getting 14 days ago would not have recovered by now, because the recovery time of anyone who has been infected is about 14 days or so. So we believe that once we move towards the end of July, our recovery rate would have gone up and would have caught on with our infections. I mean, early June, we were very, very low in terms of infection. It's only around the 7th that our numbers started doubling up, because that is when that is when people started mingling a lot, especially when the lockdown regulations for level 3 were were reduced a little bit. So that's why you see that our numbers are only started going up around the 14th. So around the end of July, we believe that our numbers would have caught on with, our recovery numbers would have caught on with actually our infections. Thank you very much. I think those were the 2 questions. No?
One from the witness around the that was being stolen. It says has the PPE been delivered to all the schools to prepare for the return of additional grades and their teachers?
Okay, thank you so much, Mr. Premier, and greetings to everyone and the viewers. On the first question, whether we involve parents in decision making, yes, we do, through the Association of School Governing Bodies, because parents in the schooling setup, it's them who elect SGBs as their representatives, and SGBs affiliates to different associations. So at a national level, all SGB associations are consulted and are part of decision making, just like the rest of the stakeholders, the unions and other stakeholders in the sector. Even at a provincial level, we do consult all the recognized SGB associations. The last meeting was yesterday morning, where we're taking them through developments since the CEM meeting. So indeed, we do consult the structures and bodies that represent parents. We have, however, seen a strange phenomenon in the areas of Phoenix, Chatsworth, I think, and Merebank, where certain members of SGPs in different schools around those areas have grouped themselves into what now they call an SGP forum. It's something that it's the first time we hear about. And they seem to have mandated themselves as instigators of closure of schools. So they issue out calls to parents to not to send kids to the schools, to issue out calls to close the schools and all of that. We have engaged them, and some of them have retreated, have actually said probably we may have misunderstood them, because theirs was to check if we can reconsider the decision as a department, but they are not part of those who are saying parents must not send kids to school and all of those things. So there are some that after the engagement we have had with them have actually said, no, we understand the position and the decision of the department, that as SGPs were part of the management within the sector. So SGPs actually should be working with us in terms of managing the schools, particularly against during this particular period. So we are saying there shouldn't be anyone who instigates parents or any members of society to rebel against the decision that has been taken. The minister has been clear that there is no parent who is forced to send the child to school. So if, as a parent, you think that it is not safe for you to send your child to school, it is within your right not to send the child to school, but you must follow due processes of the law. That include applying for exemption. The HOD has authority to grant exemption under certain circumstances. It also includes you now registering for homeschooling, and we have made public all those processes that are available for parents or to parents who decide not to send their kids to schools. But we want to be emphatic that we remain opposed to anyone who instigates the rebellion against the decision. We are open in terms of engagements, and most of in fact, all the decisions that we have taken are a product of thorough engagements, together with the unions, together with the SGP associations. we came to a decision that it is better to open schools. The debate has really been on the state of readiness of different schools across the country and in our province in particular. So, indeed, all stakeholders in the sector are consulted. On the question of the water and sanitation, what is the situation now? Particularly on the chemical toilets or pollution facilities. Let me start with that to say we work according to the information we receive from schools, circuits, districts. And in terms of the information that was given to head office was that across the province, we needed 1,060 chemical toilets to basically compensate for areas where we still have pit latrines, because that program has also been hindered by the challenges of COVID-19 and as well as the lockdown. And all these 1,060 chemical toilets have been provided to all the identified and affected schools. So we don't expect a challenge on this one. Obviously, there are instances where a school basically just have to clean a toilet, and it's within the school ambit really to do that. So there will be schools where we'll get photos to say these toilets are not in a state, in a proper state to be used. And when we check, the toilets are functional. It's just that they need to be cleaned, and the school, for some reason, has not cleaned them as such toilets. So we're dealing with such cases. But in terms of the number that was given to us, we have provided all of them. Equally, in terms of the water tanks, I think there were only 5 as at yesterday that were still outstanding, and I'm sure by end of today they would have been completed. The problem with water is now the erratic manner in which water gets provided into schools because of the capacity challenges of our municipalities. There are areas where obviously communities help themselves with water in school. So you wake up the following day, there's no more water in school or in a particular school, and it will probably take another day or two for the municipality to send water to school, because what we have realized that our municipalities across the province are unable to meet the demand of sending water to school in terms of our timelines and schedule, because they still have to service communities. And that is the problem now that we're dealing with in terms of water. We're trying to mobilize more capacity so that at least all our schools, there's not a single day where a particular school in the province is without water. On the last question of delivery of PPEs for the returning grades, delivery started on Friday. I must indicate that there were delays in terms of finalizing the process, because I'm sure by now you all know that we have to be pre-audited by Department or by Treasury before we can issue any other order insofar as the procurement of COVID-19 essentials is concerned. And that process between the Department of Education and Treasury took more than expected, but we have started delivering, and in all districts, PPEs, which masks in particular, were delivered to all districts on Saturday, on Friday, then delivered to schools as well as second offices in certain instances started tomorrow. Yesterday, not tomorrow, started yesterday. And we are expecting that most districts will be completing today. Those that will be outstanding, surely by tomorrow morning we should be completing, so that when learners go back home, they go back with a set of two masks. We are experiencing a challenge in 2 districts, which is Umlazi as well as Pinetown, because of some people who say they are representing business forums. They are demanding that they get work to procure and produce these PPEs, to deliver them and all of that. And they've been really disruptive. So if you get a report to say in Pinetown and Umlazi the delivery rate is low, you must understand that it's because of that. And our view is that these are not genuine business people. We're dealing with extortionists people who want to benefit through perverted ways. I mean, government is open to do business with everyone. And when we procure as government, we open up. There were 662 people who responded to the tender that was issued for PPEs. But they decided not to follow that process because they believe they have power to strong arm government to a particular direction. They believe that they will simply go to site and demand that is either you give us work or you give us percentage of what we have been paid in the work that we, and you can't have a state that will be undermined by such people. We have taken an approach to say the police must intervene. We have been in touch with the MEC for community safety in the province, and already police have started to intervene, and I'm sure tomorrow we'll be finalizing the process. We're lucky also, Mr. Premier, that there's also SNDF available. So we just want to send a message to say government will not be extorted, and they will not allow that. But we also want to call on credible, genuine business people to rise against this phenomenon, because it's a phenomenon that is disruptive. I mean, we're dealing with people who have no interest of the future of our country, because if you disrupt education, you are disrupting the future of our country. So the government will not be undermined by such people, but also we're calling on the society to rebel against this kind of a phenomenon. Business people must also stand up and say, not in our names. Let business people do business fairly and transparently with government or any other sector. But I want to assure the public that Pinetown and Umlazi districts tomorrow again will be finalizing delivery to all our schools insofar as PPEs are concerned. Thank you so much.
Thank you. Become the honorable government.
Thank you. On the question of the factory workers that are complaining about not being given the proper PPEs, we have been dealing with a number of complaints that we do get from people that work in various companies, and indeed we do respond to all those complaints that we received from people that work in different companies. We have sent our teams, and we do send our teams immediately when we do get those complaints that the staff is not being given maybe the masks, or there is no sanitization, or they are not being listened to. And I must say that we've also have a very good relations with the Department of Health at the provincial level as well as in the district level, where they have been very responsive, where there are matters in various factories where we do receive complaints from the workers that might say, we are suspecting that there's a case here and the employers are not listening to us, or we think somebody needs to take a look at this case. The Department of Health has been able to go in those factories with us, and we are able to then respond. In many instances, we find that sometimes it's not because those employers do not want to respond. Sometimes it's due to lack of understanding on what to do in case of a case that is reported. Remember, what is normally said by the Department of Health and by the Premier every time he makes those reports is that COVID is transported by us. So when we get to the workplace and we display sometimes the symptoms, and we've been told now and again that perhaps it is important that you do not report to work, maybe rather go to the Occupational Health and Safety Office and then report that you are suspecting yourself. If maybe you're worried that if you stay away from work, maybe you might be disciplined or maybe you might lose your job. And we've then find that employers do not know what to do in case they're confronted by that particular case. So we then are able to get the Department of Health, who then are able to bring everybody on board. We then advise the employers what to do in case of a case, what to do, what protocols to follow, and how to manage that particular instance, but also what to do, because you'll find that the company has got different departments, or FM is divided into different sections, and how do you go about dealing with that case, and how do you ensure that you communicate with the rest of the workers and manage the situation, as it were. So we are really supporting a lot of business people in dealing with the issues that are appearing within the work, with the workplace. The issues of abasebenzi esithola inkinga zokuthi kunabaqashi abangafuni ukulalela imlayelo kahulumeni noma bangafuni ukuhambisana nomthetho wokuthi banikeze abasebenzi izinto zokuzivikela ezifana nama sanitizer noba nezitsipho zokuthi bageze izandla nento zokuzivikela. Sikwazile ke ukuthi uma ngabe abasebenzi besifonela siyakwazi ukuya khona ezinkampanini sikhulume nabaqashi nabo abasebenzi, siyakwazi futhi ukuthi size ukuhlanganisa abasebenzi nabaqashi ukuthi kukhulunyiswane, sibasize nabaqashi ukuthi baqwashiswe ukuthi uma ngabe kukhona i-case ekhona emsebenzini udila kanjani nayo njengomqashi ukuze kube nokuthula emsebenzini, kodwa ukuze futhi kungabi khona ukuhlukumezeka kwabasebenzi emsebenzini, uthola ukuthi sekutheleleka abantu abaningi ngenxa yokuthi mhlambe umqashi akakwazanga ukuthi i-case ereportwayo ayilalele noma abalalela abasebenzi. Udaba lama retrenchments njengoba undunankulu eshilo ukuthi we are now meeting with various sectors of the businesses almost daily, every week. We have been having these meetings and they are very useful in the whole of the province, because we have been taking stock of each and every sector as to how many people are retrenching, how many in those companies people have been retrenched, and where are those people that have been retrenched, what is happening in that particular sector. And we have also insisted that they need to follow the law if there are retrenchments. What we're also doing now is that we're keeping records of those people that are getting retrenched with the view of looking at various avenues that are available, such as the reskilling, the retraining of those, because we do have partnership with the UIF of the unemployment insurance program, where people get reskilled and they are able to get into various sectors of the economy. We also have raised the issue of the UIF. There are huge backlogs within the UIF office. Sesili dlulisele emnyangweni ophezulu kwi-head office kwi-commissioner udaba le-UIF. No luhlu olude lwey'nkampani olungakatholi i-UIF imali yakhona abasebenzi kusukela ngoMay nje kukhona abangayitholi ngeshiya kaMay. So sesilisukumele impela njengesifundazwe lolu daba lakwa UIF kusukela nje kusasa sizawube si busy ne commissioner sidila nalo loludaba ukuthi yini ngempela eimbangele ukuthi kube ne backlog engaka nanokuthi yini engenziwa ukuthi abantu bangahlukumezeki ngalolu hlobo lokuthi bahlale bengenazo imali kuze kube izinyanga ezinkulu kangaka ngoba siyazi ukuthi kuyinkinga kangakanani abantu bakithi njengoba kulesi sikhathi esibhekene naso abantu bediliziwe abanye be rely on the UIF money to survive. Indeed, we've also had other companies who've been able to pay workers even half of their salaries while they are waiting for the UIF monies. And we've suggested even to others that if they are able, as you heard the Premier even saying in his statement that the cash flow is a serious problem in many businesses. But others have been able, even with those constraints, to be able to pay half of the salaries with a view that once the UIF monies are able to pay, at least people will be able then to get their monies. But also from our side, we are really working very hard in trying to support those companies and the workers as well to ensure that they get the UIF monies on time. But we want to be honest to say there is a huge backlog within that office. Thank you.
Thank you. Just to comment, will answer the question that then
No, thanks. I think there are a few issues that one will respond to. In fact, one or two. The issue of taxis which are away from Durban or Pietermaritzburg or the so-called urban areas that are always monitored, we are taking that issue. We will be engaging with the MSC and the taxi industry. We must say that we have a good relationship with the taxi industry. They are working hand in hand with the MEC, and we will want to take that. But it's a call, because if people are raising such an issue, it's a call for us to extend monitoring and compliance program to reach all areas in KwaZulu-Natal. And we will be then doing that and take a compliance monitoring to all areas. And we will ensure that the army and the police are going through throughout the province of KwaZulu-Natal to conduct monitoring. The second issue I want to add on is the issue of recoveries. I think MEC, I want to emphasize the point she raised. When you deal with the issue of recoveries in KwaZulu-Natal, you unfortunately not looking at the cases, the new cases, as the MEC is saying. If you look on the new cases are not fatalities, but are people who are infected. Now, on weekly basis, new cases are more than 1,000 weekly. And then recoveries, it takes time, because for a people to be tested and confirmed, it will take 14 days. But it will take another 14 days or more to recover. So we must understand that. And you will see that the number will keep on increasing on the side of recoveries. But we will want to request our people to behave. Stop smoking, stop absorbing alcohol, and all of those things. And I think that is important. Let me add on the issue of schools. It is quite important that we consult with school governing bodies, as the MEC has correctly underlined that the school governing bodies represent parents, and they themselves are parents, and therefore we must understand that they are the voice of the parents, and we engage with them. It is not that we are just taking risk about the lives of the children. We are mindful of all challenges that are there. We're going to continue engaging with national, including expressing the feeling of the general population, and we will be taking up issues with the national. We know that there is a strong view that says during this winter season, it might be correct and mindful not to bring back learners up until maybe it's mid-August or so. Those are issues we'll be escalating to national and discussing with the minister and with the president. We'll take up those issues with the national leadership. As coastal provinces, we get affected, not only coastal provinces, but whole of South Africa. During the winter season, we need to look on how we mitigate. And I think, though KZN is better than Gauteng and other areas in terms of weather, but the view of the citizens of the province is that maybe it would have been better if we open schools in maybe toward the end or in the middle of August. And we are taking that view. We will raise it with national. Siyafisa ukubonga ithuba lokuthi sikwazi ukunikeza i-update. Uyasikanyela ukuthi i-COVID-19 iya ngokukhula ey'ndaweni ey'ningi kwi-province yethu KwaZulu-Natal. Sekuphela iy'nsuku ezilikhulu, in fact namuhla ikhulu nanye sangena kwi-lockdown njengoba kwakusho umongameli. Noma kunjalo, i-impact ye-COVID-19 iya ibonakala ey'ndaweni zonke. Ngokwesibalo esikhona kuyakhombisa ukuthi wonke ama-district njengamanje a-affected. Ama-cases asebekhona KwaZulu-Natal iyonke angu-13,984, kanti abantu esebedlule emhlabeni bangu-182. Kusiphatha kabi ukubona ukuthi kunabantu abasadinaya befuna ukukhanda engathi asikho lesifo. Bekwenza lokho ngoba bethi abakabona umuntu oke washona noma ogulayo. Lokho kuyinkinga ngoba kunyusa amazinga okuthelelana ebantwini. Siyafisa ke ukunxusa imiphakathi yethu yonke ukuthi ikwazi ukuziphatha ngendlela, ilandele imigomo yonke ebekiwe, okuwasha izandla ngamanzi nensipho, ukusanitizer, ukwazi ukwenza i-social distancing uma sisey'ndaweni zomphakathi, kuthi uma sikhwehlela noma sithimula sikhwehlelele sithimulele endololwaneni sigoqile. Ngaphe kwalokho, isimo sithanda ukukhombisa ukunyuka eThekwini naseMgungundlovu and still kwiLembe. iTheku lilodwa sahamba phambili namanje ey'balweni zabantu ababa affected, but also nabantu asebesishiyile emhlabeni. Yingakho-ke sinxusa ukuthi sikwazi ukuyivikela kuzo zonke.
All right, that's the update then from KZN. We of course heard from the Premier Sihle Zikalala, as well as the Health MEC Nomagugu Simelane Zulu, and the Education MEC in KZN Kwazim Shengo, as well as Nomusa Dube Ncube, who's the COGTA MEC. With regards to the returning of schools, we heard the Premier saying that there is progress in his province, but that they have opted to delay grade R's returning to school, reminding us that we are in the eye of the storm at the moment. Of course, all of this in anticipation of the Minister of Basic Education, Angie Motshekga, about to address us at 4 p.m. about really what's going on with regards to schools, the returning of schools tomorrow. We had heard earlier in the week that grade R's, grade 6s and grade 11s would be returning to school tomorrow. So that's an update from the province of KZN. The Education MEC in KZN, Kwazim Shengo, saying that they're opposed to people who are instigating the school-going decision. There are a group of people apparently in KZN who are refusing to adhere to what the government is asking when it comes to the returning to school of learners. So certainly this is a story that will stay stay on for the rest of the day as we head to 4 p.m. when we'll indeed hear from the Minister of Basic Education. For now,